Churches Health Association of Zambia at 50. At the very core of Christianity is the ministry of healing and caring for the sick and afflicted. This is largely because Jesus Christ is seen as the great physician among the Christians. As missionaries came from far and wide, they came with the great commission of Jesus Christ of going to the world, preaching the gospel, and healing the sick. When these missions began to grow, they established mission hospitals through which they would help and care for the sick. Missionaries have existed in Zambia since the close of the 19th century and have formed an integral part of the public health services in the country. Some of the oldest church health institutions are Kaleni Missions Hospital, owned by the Christian missions in many lands in Ikelenga District, Northwestern Province. Santa Maria Rural Health Center, owned by the Catholic Church on Chulubi Island, Northern Province. Macha Mission Hospital, owned by the Brethren in Christ Church in Choma District, Southern Province. And Kayambi Mission Hospital in Mungwi District, Northern Province, where the White Fathers set up the first Catholic parish in 1895. Pre-CMAZ era. Prior to 1970, the medical committees of the Christian Council of Zambia and the Zambia Episcopal Conference met regularly to discuss matters of common interest and adopt common positions in dialogue with the government. In September 1968, a Dr. Hosea Namilikwa of Tanzania and a Reverend Dr. Jack Wilkinson, who had worked as a doctor with the Kenyan Presbyterian Church, came to Zambia. They visited nearly all the church-related hospitals and clinics. With the assistance of the Christian Medical Commission of the World Council of Churches, it was decided that one organ should be created to represent and provide support to all church-administered health institutions in the country. A working group for the establishment of the Churches Medical Association of Zambia was formed soon after Dr. Hosea and Reverend Dr. Jack's visit in 1968. The team consisted of Father Crispin Brennan, Dr. Charles Musk, and Dr. James Kearns. In December 1969, the Christian Medical Commission held a meeting at the Trinity Church Hall in Lusaka to finalize the draft constitution for the proposed Churches Medical Association of Zambia. The birth of CMAZ. A meeting to launch the new association was held in the chapter house of the Cathedral of the Holy Cross in Lusaka in 1970. The initial members of the churches that began Churches Medical Association of Zambia were the Roman Catholics, United Church of Zambia, Anglican Church, Reformed Church in Zambia, Salvation Army, and the Christian Mission in many lands. CMAZ began as an association of 29 hospitals and 44 rural health centers. Since its creation in 1970 as an umbrella body of the church-administered health institutions, CMAZ provided a forum on which church health institutions took a united stance over matters of common interest. The first secretariat offices were at plot number 109, Ngwezi Road in Roma, which was the home to the first General Secretary of CMAZ, James Kearns. Dr. James Kearns, who was a surgeon at St. Francis Hospital in Katete, was the first chairman of CMAZ from 1970 to 1976 and was re-elected from 1978 to 1992. By the year 1975, all the 13 churches involved in healthcare work with extensive preventive programs supported CMAZ. Together, the member institutions of CMAZ performed 35% of Zambia's total healthcare, and all of which were in the rural areas. CMAZ and GRZ Ministry of Health. CMAZ and the Ministry of Health agreed on a Memorandum of Understanding in 1979. The Ministry of Health agreed to provide essential supporting services to the church health institutions under the CMAZ umbrella. Through this collaboration, the Ministry of Health and CMAZ recognized and utilized each other's expertise, which brought about efficient utilization of existing resources. CMAZ and GRZ leadership. In 1980, CMAZ celebrated its 10th anniversary. On that occasion, His Excellency the late President, Dr. Kenneth David Kaunda, personally delivered a message of good wishes to the association, ending his speech as follows. The party welcomes your sacrifices. Do know that we recognize your work and give it the highest appreciation. I wish you all the best in the future in your service and sacrifice for your fellow men. May God bless and guide you. At the close of 1989, membership of mission medical institutions registered with CMAZ had risen to 86. By 1991, CMAZ continued recording increased donor support. Dr. Kearns steps down from chairmanship. In 1992, having served as chairman for 15 years, in view of the heavy surgical workload in Eastern Province, Dr. Kearns stepped down as chairman. A new executive committee was elected and Dr. Ellen Anderson of Monze Hospital took over from Dr. Kearns. By the year 2001, the membership had risen to 113, made up of health institutions, organizations, and community-based health programs representing 16 different churches and church organizations. From CMAZ to Chaz. In 2001, it was generally felt that the word medical in CMAZ was restrictive in an organization whose member institutions offered comprehensive and holistic health services, including curative, preventive, and promotive. For this reason, it was resolved to replace medical with health. Notice was given to the Registrar of Societies to effect the change accordingly. Hence the Churches Health Association of Zambia, Chaz, coming into being during the 31st Annual General Council. 30th March 2003, Global Fund. Chaz was selected as one of the principal recipients of the Global Fund in Zambia, with specific support to religious institutions and faith-based organizations. On 30th March, the association signed a $9 million grant agreement with Global Fund for HIV, TB, and malaria. At the time, Chaz only had 23 members of staff. Over the years, Chaz has transformed from being a small indigenous organization to the largest faith-based organization in the health sector. Dr. Simon Buka, who took over from Dr. Godfrey Biemba, served as Executive Director of Chaz from 2007 until his untimely death in 2008. Mrs. Karen Sichinga. Prior to becoming Executive Director in 2008, Mrs. Sichinga, who joined Chaz in 1991, served as Programs Officer, Health Programs Manager, and Director of Programs at Chaz. During Mrs. Sichinga's tenure, Chaz has had an unbroken record of Global Fund Principal Recipient status in Zambia and gained the reputation as a leading health NGO securing government and donor confidence. The new Chaz Complex. In 2009, the Chaz Board passed a resolution to relocate the Secretariat from the Central Business District Office on Bembela Road to Ibex Meanwood. This was due to the growth of the Secretariat in terms of human resource coupled with heavy traffic as Lusaka Central Business District grew in population. However, funding to construct the new office was not available. 7 years later, in 2016, the situation in the Central Business District had worsened as blocked drainages caused floods even up to the office's vicinity. On 22nd April 2016, the board resolved to sell both Chaz House and Amandra House in order to finance the construction of the new office block away from the Central Business District. By the end of 2017, both structures were sold. In August 2018, the Secretariat moved to the pharmaceutical warehouse offices. This was done to save on the rental costs. By this time, the construction of the 3 floors building had begun. Finally, on 22nd April 2020, exactly 4 years after the sale of Chaz and Amandra House, the Secretariat moved into the newly constructed Chaz House. The 1,420 square meter dichotomy office space has 3 floors with over 40 offices and 6 boardrooms. Chaz today. Chaz has grown its membership to 157 church health institutions owned by 17 member churches. the association has grown to include state-of-the-art laboratory services, warehouse storage for drugs and various medical supplies, a medical equipment workshop, as well as conference facilities. Chaz and its facilities. Chaz has had unique links with church health institutions because it was created by, exists for, and is governed by these institutions. As long as church health institutions exist, there will be need for Chaz. Chaz has continued to play the role of representing the interests of the church health institutions just as it did when it started as CMAZ. From a house on plot 109 Gwezi Road in Roma to the noise and crowds in the Central Business District on plot 9306 Benbella Road, and now to the serene, free and spacious location east of Lusaka town, Chaz has continued to grow from strength to strength.